So our first question is how to treat benzodiazepine poisoning. Actually, it is not benzodiazepine poisoning. I think it is organophosphorus poisoning. How to treat organophosphorus poisoning? General measures of organophosphorus poisoning. First, maintain ABC, airway clearance by suction, breathing by oxygen inhalation, and circulation by IV fluid. Then remove the contaminated cloths and wash the affected skin. And gastric lavage if patient comes within 1 hour, because the gastric content is absorbed after 1 hour. And catheterization should be done. And a specific treatment is injection atropine, 3 ampoule IV start and repeat 10 minutes interval till atropinization. Atropinization characterized by mydriasis, that means dilatation of the pupil, dry tongue, and tachycardia. Injection atropine is reduced gradually and withdrawn after 3 to 5 days. It is not suddenly stopped because there is withdrawal effect and the patient will develop further symptom of organophosphorus compound poisoning, and that is very much harmful for the patient. So we should not withdraw the drug suddenly just after atropinization. We should maintain the treatment and gradually taper and then withdraw after 3 to 5 days. Injection pralidoxime, it is a antidote for your nicotinic receptor. It is given 2 gram IV slowly over not 1 hour, but over 10 to 15 minutes, and then repeat it. Injection ceftriaxone, broad spectrum antibiotic to combat infection. And injection saddle, not always given, but it is only given if there is a convulsion. Mechanical ventilation, the patient has got respiratory failure, otherwise it is not needed. We can treat this patient in general ward. Now our next question is, what are the features of osteomalacia? And first of all, symptoms. Mild osteomalacia may be asymptomatic. Only moderate to severe osteomalacia produces symptoms. All patients of osteomalacia will not produce symptoms. I think osteomalacia, I think you know, the osteomalacia is a metabolic disease of the bone, especially in adult patients due to vitamin D deficiency. And in osteomalacia, mild osteomalacia, patient may be asymptomatic, but in moderate to severe cases, the patient is symptomatic. And the symptoms are pain in muscles and bone. Pain in muscles and bone. Both are tender and pain. And proximal myopathy means weakness of the thigh muscles and severe osteomalacia. Patient feel discomfort when get up from chair or sit in chair. And back pain due to fracture of the ribs and pelvis. The patient in severe form of osteomalacia, the patient may feel severe back pain, and sign is tenderness in muscles and bones. Our next question is Reiter's disease. Reiter's disease is characterized by oligoarthritis. Oligoarthritis means more than one, but 2 to 4 joints are involved in oligoarthritis. And oligoarthritis patient have asymmetrical involvement. Mainly in the lower limbs joints, like knee joints and ankle joints. These joints are mainly affected. Urethritis, there is infection in the urethra, and it is non-specific, non-gonococcal. And most common born organism is chlamydia. Another one is conjunctivitis, that is infection of the conjunctiva, and it occurs within 1 to 3 weeks of sexual exposure. But this exposure is not by gonorrhea or syphilis. It is non-specific infection. And another is bacillary dysentery. These two are the predisposing factor for this Reiter's disease. Our next question is, what are the complications of enteric fever? Enteric fever, GIT complication of enteric fever, which occurs in second week or third week, and perforation of the ileum, especially the Pierre species of the ileum is perforated, and the patient may complain severe lower abdominal pain, cord-like rigidity in the lower abdomen, peritonitis developed, and in hemorrhage is in the form of hematopragia, the patient may complain. Among the neurological features, the patient may develop delirium. Delirium, I think you know, delirium means your confusional state with impairment of consciousness. If a patient has got both confusion and impairment of consciousness, that is called delirium. That is loss of memory. Confusion means impairment of memory with impairment of consciousness. Delirium. Encephalitis, that is infection of the parenchyma of the brain, meningitis and trauma. These are the complications of enteric fever. And others complications are systemic myocarditis, that is infection of the myocardium of the heart, nephritis, glomerulus of the kidney, cholecystitis, gallbladder is also involved. So these are the complications of enteric fever. And next is what are the complications of diphtheria? Local complication is palatal palsy, especially the south palate is affected. And there may be high pitch of laryngeal obstruction, and the patient may arthritis and so after the key yesterday. Hey, about कैसे गया? Yes. What is seizure? Seizure is a clinical event due to abnormal electrical discharge from the cerebral neurons. And the difference between seizure and epilepsy is the tendency to have recurrent seizure. Epilepsy is the tendency to have recurrent seizure. Next, what are the first line drug of grand mal epilepsy? What are the first line drug of grand mal epilepsy? Grand mal epilepsy are sodium valproate, carbamazepine, ethoxamide. And sodium valproate is carbamazepine is a drug of choice, first line drug of choice for generalized tonic-clonic seizure. Sodium valproate, ethoxamide is first line drug for your ethoxamide is first line drug for absence. Absence means the patient has only loss of consciousness, but there will be no seizure or convulsion. And sodium valproate is also first line of drug in your generalized tonic-clonic seizure. How to treat scabies? A specific treatment of scabies is local topical ointment, 5% permethrin. In diluted form, apply in whole body except face and repeat after 7 days. Systemic drug ivermectin, orally 200 microgram per kg, single dose, also used. Antihistamine, tablet loratadine, 10 mg daily for 7 days. And general measures, all family members should be treated by same drug at a time, and washing of the clothes and bed sheets used by the patient. What are the causes of syncope? Syncope means loss of consciousness due to reduced cerebral circulation. And types of syncopes are cardiac syncope, vasovagal syncope, postural syncope, cough syncope, micturition syncope. And again, cardiac syncope occurs due to some cardiac disease like acute myocardial infarction, hypertrophic cardiomyopathy, complete heart block, which is known as stroke Adams attack. Vasovagal syncope it is due to stimulation of the vagus nerve, not sympathetic nerve, parasympathetic vagus. And postural syncope due to prolonged standing, cough syncope due to non-productive cough, severe non-productive cough, micturition syncope, which occurs during micturition, especially in benign enlargement of the prostate. Now, what are the features of Stokes-Adams syncope? It is a variety of syncope caused by complete heart block and characterized by fainting and transient loss of consciousness. Transient loss of consciousness. It is a variety of syncope caused by complete heart block, characterized by fainting or transient loss of consciousness. A complete heart block patient having transient loss of consciousness, diagnosis is Stokes-Adams syncope. And the symptoms of the Stokes-Adams syncope are dizziness. Dizziness means vertigo and sudden loss of consciousness. And sign pale looking, death-like appearance, heart rate 40 beats per minute, high volume pulse, canonade in the jugular veins, and variable intensity of the first ultrasound due to atrioventricular asynchronicity. That is atrioventricular dissociation. So in card number 24, what are the antihypertensive drugs indicated in pregnancy? And the drugs used in pregnancy are amlodipine, atenolol, bisoprolol, methyl-dopamine, labetalol. These are the drugs that can safely used in pregnancy. But the drugs contraindicated in pregnancy is SC inhibitor. SC inhibitor is the drug which is contraindicated in pregnancy. What are the selective investigation in a hypertensive patients? X-ray chest is done in hypertensive patient to see rib notching in coarctation of the aorta, cardiomegaly, which can occur in any type of hypertension, heart failure, that is LVH, this can be detected by X-ray test. Echo detects the type of ventricular hypertrophy. And TSH to detect hypothyroidism, T4 hyperthyroidism. Ultrasonography of the kidney to detect renal parenchymal disease and adult polycystic kidney disease. Renal artery angiography to confirm renal artery stenosis. Urinary filament to detect pheochromocytoma. And urinary cortisol to detect Cushing syndrome. Now, what is the clinical presentation of scabies? Itching in whole body and papullovesicular rash in the interdigital space of the hand and also groin in adults. But in children, pustular rash in sole of the foot and palm of the hand. What are the causes of paraplegia? There are two types of paraplegia. Paraplegia means weakness in the both lower limbs. Spastic paraplegia, which occurs in upper motor neuron lesion, and flaccid paraplegia, which occurs in lower motor neuron lesion. And the disease causing spastic paraplegia, POTS disease. POTS disease is the tuberculosis of the spine of the vertebra. And multiple sclerosis is a demyelinating disease of the spinal cord and the motor tracts of the central nervous system. And transverse myelitis, it is the infection of the parenchyma of the spinal cord. Neurosyphilis and syringomyelia. Neurosyphilis is a variety of syphilis where the central nervous system is involved. And syringomyelia means multiple cavity or shearings in the spinal cord. These are the causes of this spastic paraplegia. And the causes of flaccid paraplegia are GBS, Guillain-Barré syndrome. Guillain-Barré syndrome usually occurs suddenly. Weakness starts from the lower limbs. Hello? Hello? Flaccid paraplegia is caused by GBS, Guillain-Barré syndrome. Guillain-Barré syndrome is a acute motor neuropathy which occurs after viral infection. Cordyceps syndrome occurs where the lesion in the cordyceps, that is nerve roots from the lower root of the lower part of the spinal cord. What are the effects of lesion of the spinal cord above cervical 5? If lesion at the leg of spinal cord occurs above C5, then both upper and lower limbs will be affected. And there will be spastic quadriplegia. That is, both upper and lower limbs paralysis will occur. And loss of sensation. All modalities of sensation will be lost in both upper and lower limbs. How will you treat chloroquine-resistant malaria? Chloroquine-resistant malaria is treated orally by quinine dihydrochloride, 300 milligram. 300 milligram. I'm gonna vouch for toast. 2-tab TDS for 5 days. Or QRT method, 4-tab on day 0, 8, 24, 36, 48, and 60. This 6 days 4 tablet daily should be given co-artemether. And injectable form, two drugs are available. One is injection artesunate, 2.4 milligram per kg, 2.4 milligram per kg body weight, IV daily for 5 days, 7 days. And quinine dihydrochloride, starting dose 20 milligram in 100 ml 25% glucose over 4 hours, then 10 milligram per kg body weight in 100 ml 25% glucose over next 4 hours, and repeat 8 hourly for 5 days. How will you treat calajoid? Injection sodium istibogluconate 20 milligram per kg body weight IV daily for 28 days. টাইম শেষ। আচ্ছা যে এইটা শেষ করে দেবো, হয়ে গেছে আরেকটা আছে। Injection sodium gluconate, then injection amphotericin B 0.75 milligram per kg per day on alternative, and tablet meltifosine 100 milligram per day for 28 days. And last question is how to treat ankylosing spondylitis. General measures: physiotherapy like swimming and cycling, and specific treatment tablet sulfasalazine and MTX given for 1 year. Folic acid with MTX, naproxen 3 weeks. And this is the end of today's class. So thank you for patient sharing. সবাইকে ধন্যবাদ।